How are you today? I'm Robin Marshall. I'm on the air at K104.7, and I have somebody very special with me today. I'm very excited to be with him. This is Dr. David Klein of Renaissance Plastic Surgery. He's going to answer questions that you have been afraid to ask for years. So that's a problem with many women. We all think alike. I don't care. I'm from New York. You're from Charlotte. We all think the same thoughts, but some of us are more open than others.
Absolutely.
So my job is to bring it out of you to answer their questions.
Okay.
All right. What I want to talk to you about is body contouring.
Mm-hmm.
And I know that that includes liposuction, but it's inclusive of a whole bunch of different things that I wasn't really even aware of. Would you be able to give a little bit of detail?
Sure. I think that, like you, a lot of people aren't really sure exactly what that means, and it means different things to different people. When I'm talking about body contouring, I'm really not thinking about the breast. That's kind of a category in and of itself. I'm mainly thinking about the trunk, the legs, the buttocks, that type of thing. And the simplest and most common thing, and it's almost always the #1 procedure, surgical procedure in the world every year, certainly in the United States, is liposuction. And liposuction very simply is making tiny incisions near the body part that is bothering you, such as the hip, buttocks, tummy, waist, and taking a little cannula and going in there and essentially vacuuming the fat out. There are options such as laser, ultrasound assisted, and so forth. The bottom line is whichever method is used, very tiny incisions, very safe procedure, removing fat cells in a certain area that you can't do by losing weight.
And when you do that, what happens? I've heard stories,
Mm-hmm.
so I'm just going to ask what you are probably wondering. What happens to your skin if you had a lot removed? Does your skin get very saggy?
A loaded question.
Okay.
And it depends on age.
Okay.
It depends on the skin, the body part. Certain areas such as the posterior hip and waist, you can suction a boatload out of there and that skin always conforms to the waist and down to the buttocks. Always. It's very thick.
Oh.
Abdomen, not always guaranteed that it'll be okay, because if you've had stretch marks from children or massive weight loss, that skin is not resilient enough to come back if you take out a large volume. So liposuction is more for shaping, not major changes. So it's making a bulge a curve, a sexier curve.
Now, I would never have figured that out.
Sure.
That's very nice to know. So after you do the liposuction, is there a fear for the woman that she's going to either regain this weight, or how does it stay in shape?
Sure. A very common question is, what I often hear is, my girlfriend had her buttocks sucked out, now she's got fat ankles. Well, the problem
I've never heard that one.
Well, that's because you don't do what I do.
That's right.
You're on the radio. So what that is basically when you suction fat out from somewhere, your body has a set number of fat cells. When you went through puberty and I went through puberty, the number was set. When you gain and lose weight, those cells individually expand. Girls tend to put it hip to knees because genetically that's where females have more of their fat cells. Your fingers get a little fatter, but there aren't very many fat cells there, but your ring gets tighter. Mm-hmm. So when we suck those fat cells out of a certain area, your body doesn't say, hey, I need to put that fat somewhere else because that fat's in the bucket.
Okay.
And it's not going to come back. But if you gain weight, let's say you gain 20 pounds.
After the liposuction?
After the liposuction, right. Since in the past you had a lot of fat cells here when you gained 20 pounds, that belly would get bigger. Mm-hmm. Well, it can only get so much bigger because most of those fat cells are gone. But the leg or the buttocks or something else, that's your next most populated area with fat cells, because each one grows a little bit, that area gets bigger. So if you maintain your weight after liposuction, nothing else gets bigger. You don't suddenly have fat ankles just because you had your abdomen sucked out.
So if somebody did gain 25 pounds, they wouldn't regain it in this spot where they had the liposuction?
It would not regain the same amount. In other words,
it would just distribute.
Yes, it redistributes the same amount of weight, but those cells can only expand so much because there's less of them.
Got it.
So the rest of, so you may notice that at a given weight, your arms are heavier than they were prior to the liposuction, because prior to the liposuction, more of that weight went into the area where there were more cells, i.e. the belly.
Got it. Very interesting.
Mhm.
Now, let's talk about tummy tucks.
Sure.
I have lots of questions about that. I think that's one thing that many women are afraid of because of scarring. Where does the skin go? Or, you need to answer these questions.
Right. Well, let me tell you what I hear most of the time. Women come in and they say, I need a tummy tuck. And I'll look at them, and they really don't, because their skin is good, and we can do a little liposuction, which we just talked about. Their shape will improve, and it's a very simple procedure. Other women come in and say, all I want is liposuction, but they've had 8 children,
Yes.
they have no elasticity, lots of stretch marks, and their skin hangs halfway down their thighs. Liposuction does not help skin. So there's a lot of confusion between those two things. Both of them improve your shape. Liposuction only shapes the fatty tissue if the skin around it is good.
Got it.
If the skin has been overstretched with massive weight loss, several pregnancies, stretch marks, etc., and the skin is loose, it will not shrink no matter how much fat you suck out from behind it. So that's when you're trimming it off. Regarding the scars, all of the abdominoplasty scars are down low, down under the bikini line, hip to hip typically. If it's just a little pooch at the bottom, maybe a mini tummy tuck. Not that many people really qualify for a mini tummy tuck. Most people, if they've been stretched enough to need a tummy tuck, they probably need the real thing. Because we not only tighten the skin, but we tighten that muscle up. So when you're walking across the pool on your bathing suit, you don't have to suck it in anymore. I'm going to suck it in for you.
Oh, wow.
I'm going to tighten you up.
But the scarring is under your panty line, that's what you said?
Correct.
Okay.
Yes, it is.
That's
Yes, it
important
is.
to know,
Right.
because I never really understood how that
Right, right. And you keep your same belly button. Your belly button stays right where it is. I don't move it. I move the skin around it and bring it back out.
Now that is a question I wouldn't have even thought to ask.
I get asked that every time.
I love it.
Every time.
Now what about body lifting?
Okay.
What is it?
It means a lot of different things. We're in this age of now with all the gastric bypass and lap bands, people are losing 100, 200, 300 pounds. Well, as you could guess, that skin has been overstretched.
Right.
And so whether there's stretch marks or not, it can only, again, shrink so much. And so a lot of times I'll see these folks that have lost a couple hundred pounds and their abdomen literally, the skin, since it's empty, is all the way down to the knees. It's kind of like your foot's in a sock.
Yes.
You pull your foot halfway out, what happens to the toe? It sags.
Right.
So if you shrink the fatty tissue by losing all this weight, the skin starts to sag. And that's from the face to the legs to the belly to everything. So when you're talking about body lifting, it may mean lifting up the thighs, lifting up the buttocks, lifting up the abdomen, and getting rid of all this excess skin.
When you say lifting, where do you put it? I mean, how did...
Yes, well...
I don't understand that.
Yeah, without a
Well, I mean,
to show you, but let's say at the belt line.
Right,
If your belt line, your skin is hanging past it,
right.
well, you don't want it to hang past it, so you actually just trim it off and throw that skin away.
This is too much for me to...
Well, it's that's why you're asleep while we do
That's
it.
okay.
We don't want you
Well.
watching. Yes, but it's pretty straightforward actually.
But I don't understand what the difference is between a tummy tuck then and a body lift. Is it just different parts of the body?
Well, it's more semantics, it's more words. A tummy tuck and a big body lift after a 200-pound weight loss, it's basically the same principles. You're taking away the excess skin, you're tightening the underlying musculature and fascia, but with a body lift, I might go 360 degrees around the body.
Got it. Okay,
So
now I understand.
Yes, we're getting, tummy tuck mainly is in the front where the babies have stretched.
Okay. Well, thank you so much. I just have learned so much from
Sure.
you. It's wonderful, and I hope that we can do more and
Absolutely.
learn more. I'm sure there are so many more things that I don't even know what to ask about.
Well, we'll go over them in time.
Okay.
All right.
Dr. David Klein with Renaissance Plastic Surgery, and I'm Robin Marshall. Thank you so much for listening and watching.